California drivers, do you remember when I warned you about this Proposition 22 and they were making you these fancy offers, all going to pay for medical care and all of this? Well, nothing materialized, right? And you got completely shafted by voting with them, right? With the company, believing they would honor these promises. Now, Uber and Lyft drivers say new California law isn't solving their health care needs, right? They made these big, bold promises to you. Now the drivers complaining. We're not getting the health care we were promised. Voters were sold misinformation, right? Based on what we're seeing on the ground, state legislator says. And why don't these state legislators take action, right? So, I mean, let's listen to the article. Why not?
Uber Lyft drivers say new California law isn't solving their health care needs. By Levi Sumagazi. June 16, 2021, 7:47 a.m. Eastern Time.
That's right.
A ballot initiative passed by California voters last fall has failed to make good on its promise to ride-hailing drivers, state lawmakers and drivers said Tuesday. Voters were sold misinformation based on what we're seeing on the ground, State Assemblymember Wendy Carrillo said. The state reopened after more than a year of COVID-19 related restrictions, which is expected to lead to a ride-hailing rebound, and drivers are calling on Uber Technologies Incorporated and Lyft Incorporated to automatically provide them with the health insurance subsidy that was promised to them under Proposition 22. A survey commissioned by SEIU 721 shows that only 15% of drivers polled had applied for the stipend, and nearly 86% are likely to be deemed ineligible. Proposition 22 was passed by 58% of California voters in November after Uber, Lyft, DoorDash Incorporated, and Instacart spent more than $200 million on the campaign. The initiative, which allows gig companies to continue to treat their workers as independent contractors, promised a guaranteed wage for drivers, plus healthcare stipends for those who work for the app's 15 hours a week or more. But drivers are finding that many of them don't qualify for the stipends, which a Sacramento Bee report says covers about 40% of the average premium for the lowest tier of a covered California plan, especially if they have health coverage through the state. Naid Tamarau, a Lyft driver who spoke at a news conference organized by We Drive Progress and Mobile Workers Alliance, said she worked about 50 hours a week before the pandemic to make ends meet. After Proposition 22, she said nothing has really changed.
There we go.
I still work 50 hours a week and my earnings are still barely enough to get by. I don't make enough money, so I'm on Medi-California. Tamarau said she was rejected when she applied for the healthcare stipend because she was on medical, the state's health insurance program for low-income individuals and families, plus those who are elderly, blind, or disabled. They know a lot of their drivers are already on Medicare and medical, added Jerome Gage, a Southern California-based driver for Uber and Lyft and a worker organizer. If you have an employer-based healthcare plan that also disqualifies you, they put all these barriers in place. Mentioning that Lyft is scheduled to hold its annual general meeting on Thursday, Carrillo, a Democrat who represents the 51st Assembly District that includes East Los Angeles, said Lyft shareholders should know their company promised good wages and health care. They have not kept their promise. Lyft did not return a request for comment, but not. Jeff Vetter, a spokesman for the Protect app-based drivers and services coalition, said the companies have communicated to the drivers about how to qualify and apply for the new health benefits. In the 5 months since Prop 22 passed, thousands have started receiving the healthcare stipend and more will sign up to receive it as app-based work rebounds, Vetter said. An Uber spokeswoman sent the following statement. The goal of the healthcare stipend is to provide the drivers and delivery people who don't already have health insurance a path to access coverage. Surveys of drivers and delivery people with Uber show that the vast majority already have health insurance coverage from a separate employer, through a spouse, prior service, or some other source. The drivers and 2 members of the state assembly also called for federal action by way of passage of the PRO Act, which would give drivers the right to organize. In addition, they urged the National Labor Relations Board to classify drivers as employees, not independent contractors. The PRO Act was passed by the U.S. House of Representatives in March. The Senate has yet to take it up and may not do so because it does not appear to have enough support from senators. See PRO Act, called most important labor legislation in several generations, passes House. State Assembly member Miguel Santiago, a Democrat who represents the district that includes downtown Los Angeles, said the state is subsidizing the gig companies. Carrillo also pointed out that taxpayers had to cover 100% of cost of unemployment for drivers who were out of work because of the pandemic, because Uber, Lyft, and other gig companies do not pay into states' unemployment insurance funds. See Uber, Lyft, and DoorDash stocks plunge after Biden's labor secretary says in a lot of cases, gig workers should be classified as employees. Lucas Chamberlain, a driver in San Francisco, said he has worked for almost all the ride-hailing and delivery apps and has done about 6,000 trips with Uber. He too is on medical and was denied the health care stipend. In 2019, he said he was doing a delivery for Uber Eats on his Vespa when he was struck by a vehicle. He needed surgery on his leg and physical therapy afterward, none of which Uber paid for, he said. Under Proposition 22, drivers are now supposed to be automatically enrolled in accident protection insurance. I deserve to be an employee, to be treated equally. I deserve PTO and sick leave, Chamberlain said. They should be ashamed, Chamberlain said of gig companies. I'm not a number, I'm a person, and I deserve to be treated fairly by these corporations.
That's true, my friend. You deserve that, right? We deserve that. And unfortunately, they sold us a big lie. So my advice to you is stay far away from these companies. They've lied over the years. You got nothing in return, right? Do reach out to Bryant Greening at Legal Rideshare. If you get into an accident, don't waste time. Reach out to them right away. They act in all 50 states, ladies and gentlemen. Fantastic guy. He certainly has the driver's back, right? Check them out at legalrideshare.com. They also help with deactivations. But the one thing I wanna tell you is that if you do not follow the right protocol, right, or if you are with a company that's just not doing anything for you, switch course, right? Contact these guys and make sure they collect the maximum for you. Have a great day, my friends. Stay safe out there, and do leave me some feedback as far as the healthcare goes in California. Are you receiving it? Are you happy with it? Do you feel conned by the company after this Proposition 22? I'd really love to hear your feedback. Have a great day.